Remember earlier on the show, we saw that list, and like pretty much the top of that COVID infection rate, the positive rate, was all like all these states redness that like people who are denying it, people who are like, for their freedom, they want to have Thanksgiving, they really have dry ass turkey that badly. I don't understand.
Because most of the motherfuckers can't cook, so
Yeah,
let's
so
just be real about that.
Bland ass potato salad. I'm not gonna die over that.
They
That's
put
not a
peas.
hill.
They put peas in that potato
That's
salad.
not a hill I'm gonna die on, at all. So
nah, I mean, you try to eat that shit and you will die.
So the New York Times actually confirmed what Dr. Eugene said earlier in the show. It says the states that imposed a few restrictions now have the worst outbreaks. It's like the most obvious headline, but I guess we need these kind of obvious headlines nowadays for people to
Almost as if the virus doesn't give a fuck about your politics.
Oh, what restrictions mean it's going to be worse? The New York Times, like, great. Thank you for New York Times for being eloquent with how silly people are being right now. So you see like the fewer containment measures. There's all these states. Florida is over here. South Dakota is like off the map. South Dakota is like on my like desktop. It's like off the map. It's like, that is crazy. That is shocking.
They have the highest death rate per capita on planet Earth.
On planet Earth? You serious?
On planet Earth. Not just here in the United States. On planet Earth. Highest death rate.
One state.
I mean, USA is number one.
So you see here, it's really sad that like there's only a handful of states that have the tightest control. And New York City wasn't that tight, They had all the bars open, what I mean? But it still was better than like these like apocalyptic numbers on this side. This is like intense. But you can see like Massachusetts,
like Mount Everest.
Yeah, Vermont, Delaware, California, Connecticut, Hawaii. I mean, that's all. Maine, Rhode Island, New York, and New Mexico. And you see they have New Mexico is kind of getting a little bad right now.
And they hear Trump constantly try to argue with Fauci, somebody who actually knows what the fuck he's talking about. And all of these virologists and epidemiologists say, hey, the fall and winter is going to get really bad. We need you guys to like adjust your behavior. Nope. We're arguing about Thanksgiving.
So I guess like New York City is really becoming like this study for a lot of people, for different reasons. So look at that one state. It's possible to track the relationship between coronavirus policy and public health. And I guess it's great for them to point out New York City because we live in New York City and we experienced what that public policy looked like. So we saw what happened. We saw pretty much once people was getting sick in the subway and stuff like that, they were like, yep, we got to shut this down. And that was like around like March 25th. And so the restrictions tightened as cases were rising. And then this was the dark time when things were just going up with the trucks, with the...
Check this out. Spread kindness worldwide in the Twitch chat. North and South Dakota would be the worst and third worst countries by death rate in the world by themselves if they were, just standalone countries.
Yeah.
Like, how do you have so many people dying and nobody lives there?
Yeah, it's like, crazy. I think that's the beginning of every conversation I have with people nowadays.
I think they just went out. I just think they went out there and had like a massive orgy to prove that it was a hoax. Because
no, but that's what happened.
You have people living like fucking 20 miles away from somebody, and they still gave you the Rona. Like, what's wrong with you?
No, but the problem is, it's the fact. It's a fucked up issue of like a lot of times these Native American reservations, they don't have the resources, so they have to go out of the reservation, they have to go to that town where no one's following social distancing, not wearing masks. They have to go to that Walmart, they have to go to that shopping mall, they have to go to that dentist that's outside of the reservation a lot of times. So I feel this is why Native Americans are having such a devastating infection rate in North Dakota and South Dakota. And it's still partially of manifest destiny still affecting them to this day.
I mean, the memes are out there about how, we're kind of repeating history with, sitting down to eat with a bunch of people who have not been exposed to the diseases that you're bringing. And we're calling it Thanksgiving again. It's scary how history repeats itself.
Yeah. So So I hit you guys with this sad, depressing news that has me kind of teary-eyed. But we want to show this. But this is the virus vaccine watch. So we're actually watching for hope. We need a hero. Save the day. So Phil can play this clip real quick.
Yeah, Messiah singing. He's really sad.
Yeah, it's desperate right now.
There's trial of its coronavirus.
So this video breaks down.
It is 95% effective. It's the second company to announce successful trials after Pfizer and BioNTech last week. It'll still take time for the actual vaccine to be certified, but already there's the question, will there be enough to go around? Well,
no.
Pfizer and Moderna are hoping to distribute 1 billion or more doses during the next year. Huge numbers when you compare it to the likes of Germany's CureVac, which is aiming to produce up to 400 million doses of its candidate in 2021. And prices? Well, they'll vary massively. UK-based AstraZeneca is planning to charge the EU perhaps as little as $3 a dose. Johnson & Johnson is a bit more expensive, but the two front runners, BioNTech, Pfizer, and Moderna, are expected to charge significantly more.
You see that?
Because
that scam is about to happen.
Everybody's trying to get paid, man.
Everybody's trying to get paid.
Cost. So, prospects
you want
of
that
a
help?
working vaccine appear to be promising, but where do we go from here? Let's bring in Carsten Bjeski. He's the chief economist for Germany and Austria at ING Bank. Welcome to the program, Carsten. Two hopeful candidates, which still lack certification, though. Experts said a vaccine by the end of the year would be essential.
It's not one shot, you need 2 shots.
In order to go forward and not see more economic damage. But that's a close call. We're in the middle of November.
We're getting closer there, but I would agree with these experts because that's also what we have in
you
our
can afford a
base
better
case
mic.
scenario. So our base case
He's the
scenario
ING bank chief economist. What's going on here?
A contraction in the fourth quarter, some stabilization in the first.
He's even have AirPods.
But everything is based really on this vaccine being rolled out in the course of the first half of next year. If this doesn't happen, then we're in a completely different play.
Why are people betting on this
about a recovery
like that? That's not a good look.
Really a long-lasting stagnation.
All right, let's try to stay positive here. I mean, even if the vaccine is there, it'll take time to distribute. It'll obviously take time to vaccinate all the people. How much of a challenge is this interim phase?
The interim phase, we're in this interim phase already, and we see that this is a challenge. Just see what the German government was discussing, namely a possible.
Audience, this is Europe talking about how they're getting the vaccine. So I want people to keep that in mind.
Just last weekend, we had Austria going for a stricter lockdown. Now in Europe, we even have Sweden going into a stricter lockdown. So this typical saying of things will first have to get worse before they get better. I think this is very typical for this interim phase in which we're in right now. A very tough winter, and then with the silver lining of a vaccine in the first half of next year, we would also have the prospect for people to really hang in there and then get this the recovery. But currently, the really short-term outlook is clearly not very positive.
Okay.
The German government has said so far tighter restrictions in order to rein in the pandemic are likely to slow the recovery,
real quick,
but not stall it.
So that's the news out of Europe. They're being straight up honest with people. They're like, it's not a good look right now. Just wait it out, bro. It's like, like they're not lying to people. They're not like, they listen to the scientists. They listen to the policymakers. They're taking an economic hit. Europe is taking a huge economic hit for this, and they know it.
You know what's really annoying to me?
Yeah.
What grinds my gears about all of this is that people have been saying this since fucking February. Hey, just shut the fucking shit down. Pause all the markets. Banks. I know that nothing in the world means anything to you, but your profits. But can we just pause this shit so that we can get rid of this shit and then get back to real life? Here we are in the middle of fucking November. We could have been out of this already. The only thing we had to do was shut the shit down for a month max. Just shut everything down. And they couldn't do that.
Yeah. So I want to play this so Phil can drop this video. Well, you can drop this video. I just want to get the tail end. That's like kind of the European German news agency that was showing their perspective of how they're being honest about the pricing. If you saw the reporting on an American side about the vaccines, you heard nothing about pricing. You just heard that it's coming at some point, but they're gonna get you that's what American way, right? They get you the price afterwards. You get that bill after. So so at least Europe is honest about that. But I also want to be, we're not biased here. There's also other vaccines that are being popped up. Remember Sputnik? Remember Sputnik?
5. Yep.
Yeah, apparently it got 95% positive rate, allegedly.
Time now for our daily vaccine tracker. There is a lot of buzz about the high efficacy rates being displayed by some of the vaccine candidates. Pfizer and BioNTech's shot, for example, has reportedly proven to be 95% effective in preventing the Wuhan virus. Russia has said
they call it the Wuhan
Sputnik
virus.
is
Oh
92%
shit!
effective. Moderna is promising
94.5% You can't call it the Wuhan
and
virus.
researchers now say that the Oxford and AstraZeneca
remember, they're not
candidates
very,
have shown immune
they're not
response
very
over
friendly with China.
99% of the candidates.
So,
This is based on the phase 2 of the clinical trials.
Yo,
But what do all these numbers mean for you and me?
imagine they did that
Here
on
are
CNN.
some of the questions we will be looking to answer tonight. Number one, now that we have high efficacy rates, what will the next step be for the makers of these vaccines? Number two, which countries will get the vaccines first? Number three, what will be the distribution and storage process?
There you go.
And finally, what it all comes down to, when will
This
you and I be
look at this
getting
news
the
report. It's
Wuhan
like, okay,
virus
we're gonna tell you,
vaccine shot?
we're gonna tell you what's up.
We answer these questions one by one. First,
what country will we name the
next?
vaccine after?
The World Health Organization demands a 50% efficacy for authorizing a vaccine. So vaccine candidates that have crossed that mark in phase 3 of the clinical trials, like Pfizer, Sputnik V, Moderna, will approach drug regulators of the home countries to get their vaccines authorized. Pfizer, for example, is already filing for emergency authorization with the FDA, or the US Food and Drug Administration. The regulatory authorities will conduct inspection and also investigate the claims of the drug makers. It is only after this that the authorities will award a license for manufacturing the vaccine. Given the seriousness of the Wuhan virus pandemic, the manufacturing of most vaccines has already been started so that the shots can be made available at the earliest.
That must be on the teleprompter then.
Question number 2.
Shit.
Many countries have already struck deals for leading vaccine candidates. Shots were pre-ordered even before the results for phase 3 trials were released. There are many potential vaccines in the race and one too many countries vying for them. So to avoid confusion, let's look at the pre-orders for the leading candidates. Pfizer has deals with America, the UK, Japan, and the European Union. It is to these that Pfizer will send its vaccines first.
Wow, they acted like it's a fucking India? Call of Duty
New Delhi is
release.
in talks with Pfizer.
As per you got your pre-order soon?
You gonna be the Sputnik team or you gonna be the Pfizer team?
Before it can
team
be
Pfizer
in the country. To the next candidate now, Russia has signed agreements
Xbox,
with over 10
Series
countries
X.
for Sputnik V. The list of countries include India, Saudi Arabia, Mexico, and Brazil. Moderna has deals with the United States and Japan. AstraZeneca has reached an agreement with Europe, Australia, and Brazil. India's Serum Institute is also carrying out local trials for the vaccine. Once a vaccine is manufactured, it must be transported, stored, and distributed with utmost care. So on to question number 3. What will be the storage and distribution process? As we told you yesterday, the government of India reportedly has already asked the states for all the details of the cold chain up to block level. In India, there are cold chains at various levels. There are government medical supply depots, or what's called GMSD.
They're talking
then there
like
are
the audience
state,
is smart.
regional, and divisional vaccine stores. There are also district
audience
vaccine
probably
storage
is.
points. So from all these points, the vaccines
I don't
will
know what
reach
that
the
is.
last storage point, that is the community health center or the public health center or the private facilities. And then the vaccine will be administered to the people. Each vaccine will have a different cold chain requirement. For example, if and as and when the Pfizer vaccine makes its way to India, it will require storage at minus 70 degrees Celsius. And not all Indian cold chains can facilitate that. Shelf life is also a very crucial factor here. The Moderna vaccine, for example, is stable at refrigerator temperatures for 30 days. And here too, different vaccines will have different shelf lives. Be it storage or distribution,
That's probably why
it
it's
is only fair to
$37.
think that the process will
It
be
has the
carried
easiest
out in a
shelf life. It has the
public-private
easiest way
partnership,
to
meaning there will be private
refrigerate
players
it.
involved. On to the final question. When will you and I be getting the Wuhan virus
Say when
vaccine
I'm gonna
shot?
get it.
To be honest, it's a very tricky question to answer. It all depends on when the vaccines get regulatory approval at the home countries and also the country where it is supposed to be distributed. It all depends on which vaccines come to the country that you are watching us from tonight. For example, if you are watching us from the United States, then a particular update from Pfizer would be important for you. The company has said that if everything goes well, then vaccine deliveries could start before Christmas.
Damn, she's like, you have no president, so just
A
talk
lot
to the
also depends
corporation.
on where you stand in the road priority list. In India, for example, healthcare workers
Call the
will be the
Pfizer
first
hotline and
ones
see when you get the
to be
vaccine.
getting the vaccine.
You are all kinds of foul for that.
That's
son.
cold,
Damn,
yo.
That's
Yo,
cold as
son.
shit.
Yo, if you call for America, this I don't know what to tell you. Like, just call Pfizer.
Oh man, it's funny. I watched some conversation. I forget who was talking, and the thought was that Black people are going to wait until like the third iteration of the vaccine before messing with it. They're going to watch everybody else and to see how people react to it before submitting to that shit. What do you think about that?
Oh, is it spread kindness worldwide says press 1 if your country has no president. We call Pfizer. Make sure see if the vaccine is ready. That's crazy to me. Yeah. I totally I totally feel that, like this is gonna be I think essentially apparently I heard there's some sort of chain of command that's happening because Biden wants to be president, and I heard that his team is already thinking of like how to I heard it's gonna be like essential workers, nurses, doctors, and surgeons, and then critical workers. I guess I don't know what that means. That might mean like the supermarket, like cashier. Who knows what that means? And then elderly, compromised immune systems. I think that, and then everyone else has to wait it out.
Yeah, well, we all know that. But what I asked you was, when you think about the people
No, but that's the thing. Most people are gonna be essential workers. Those are like nurse aides. Like it might force them to get the vaccine first. That's gonna be.
Oh man, that's a dirty word, man. That's a dirty 5-letter word. He's talking about forcing people to get injected
In order to keep doing your job, they might do that. They might, in order for you to keep coming to work today, you have to get the vaccine. They might set that.
If people are like,
they might set that. They might put the line in the
pig.
sand. But no, but I feel a lot of jobs are gonna set that line in the sand.
I know, but imagine people like, no, I'm not your guinea pig. I quit, and then you don't got nobody to do the job. What you gonna do then?
That's the next mess we're gonna see next year. So we have the mask mess. We have the testing mess.
I think wearing a mask is less intrusive than somebody injecting some shit into your body.
Yeah, that's what people keep telling everyone, but no one listens. No one listens to that. It's better than a ventilator being stuffed down your throat. It's better than like waiting for a double vaccine, hiding in your house. Just wear a mask. That's all people been saying for 8 months. And no one is going one ear out the other. And you're gonna breathe in your face. That's what they do. So that's the virus segment. Follow us on Facebook, Twitter, YouTube. We have over 45,000 subscribers on act.tv. We got some amazing clips there with Juliana James from the internet. Check those clips out. And that was the virus segment.